It's 14 minutes after 8 o'clock here on 97.1 Wadsworth Community Radio. And on the phone with us, we have from the village of St. Edward, John Stoner. Good morning.
Good morning.
How are you?
Great.
Good morning, John. It's been a long time since we've been able to talk.
I know, Joe. I couldn't even remember whose voices I was hearing, let alone all of us hiding behind masks these days. Voices are even tough to recognize. I don't know what it is. It's one of those things these days.
Yeah. I'm sure that, John, this probably goes without saying, but we'll have you say it. Things in the last 6 months have been very different at the village of St. Edward here in Wadsworth and at your other two facilities. Can you give us some idea of how much different they are?
Well, it's starkly different, just as many of us and the listeners are hearing and experiencing in their everyday life. Since the onset of this coronavirus pandemic, it's just turned everybody's life upside down, and that includes those of the residents of the village. And very early on, when the states of emergency were declared both by the federal and the state government, that immediately led to the restrictions, some government imposed, some that we took as a measure of safety, wherein the freedom of not only the residents but also that of the visitors and employees and everybody else was affected. And so life is not what it was before the pandemic, and certainly we're looking forward to the time when we can return to a normalcy. I hope it's not too different from the previous normalcy, but it certainly affected everybody's life in so many different ways, and certainly the residents in particular, and their life as they had known it, and now are have adjusted quite a bit, but we're still all looking forward to that vaccine and maybe a return to life as we once knew it somewhat.
Okay, John, how have the residents, I know they had to, they're helping each other through this as well. Talk a little bit about their resilience and how they've actually, sort of rebounded and made this work there within each one of the facilities.
Yes, initially, and this seems to be both the reaction of the residents as well as some of their family members. There was understandably a concern of fear about what if the coronavirus were to invade the communities, and what are the implications. And we heard many stories throughout the country about what the implications were unchecked for some of the facilities that provide offerings for senior residents. And in time, as there got to be sort of an adjustment, an acceptance, an understanding of how does this coronavirus infiltrate a community, how is it transmitted, how is it prevented, how can we work with the circumstances that are the hand that have been dealt us. The residents and the families began to transition ever so slightly toward how can we help each other? How can we continue to communicate? What can we do to continue this social vibrancy that we had before, or at least to resume it in some modified fashion, because the psychosocial implications of this separation, this lockdown, were becoming evident and of greater concern after the initial concern about the safety. So the residents have really done what they could, particularly the independent living folks who have a little more freedom because it's not as regulated as the assisted living components, have been working with each other and with our activities folks and trying to get back to a sense of there's an opportunity to do what they wanted to do, and that was some social interaction, certainly under restricted conditions with masking and with social distancing and the other things that we've come to learn are very important and integral to everyone's health safety.
John, at this time, I know the state of Ohio has laws now that, or guidance, I should say, that allows folks to visit their loved ones inside a facility like yours. Is that taking place? Do you have different rules for, let's say, a family member who would like to come and see maybe grandma or grandpa or another family member?
Yes, we've come to the point, which is wonderful, where there is personal visitation rather than people standing at the windows or hoping to see each other just on a type of iPad communication or some other, or Zoom or whatever the case may be. The technology has at least availed us, but those personal interactions have resumed very recently, and typically they're made by appointment for a limited time, and the visitors go through a screening process, as do all our employees, to try to ensure that there's not an active case of coronavirus. And the principal things are to ask some questions, ask where people have been, and to take their temperature upon arrival. And there are now the very personal and very much needed and long missed personal interactions that are taking place between family members and residents, particularly in the assisted living areas. I think independent living areas have had a little more freedom as of late. They are not as regulated, and we are not as restrictive in terms of what we once were in terms of those visitations, but certainly refreshing and wonderful to see some of these personal interactions take place again.
You know, John, the other thing that I mean, this is it's sort of in your realm, but it's I mean, you can control what's in the three facilities, but what you can't control, at least right now, is, you know, this also reaches families whose parents, relatives, aunts, uncles, anyone was getting ready to come into either independent living, assisted living, memory care, something like that they're still at home. And so a lot of those people are struggling, going, well, you know, mom, dad, grandma, grandpa, uncle, aunt, you know, they need help, they need care, they need facility, but, you know, can I do it safely? And, you know, am I going to relinquish getting to see them again? I mean, there's a big struggle, I know, on the family's part, is how do we move in the future to be sure what is best, you know, what is best for the person that I need to move into a facility like that? Do I keep, you know, if you keep them at home, I mean, it could wear on you more, you know, the caregiver as well. So that's a big struggle that, you know, at some point, I mean, you have some control over it, but you don't. Can you speak a little bit about maybe some advice to people that are, you know, what do we do?
That's one of the biggest challenges for people these days. It had been, maybe more so, but I think it's becoming a little better at this point, Tom. But you really hit it. The concern that people had, I believe, as I described previously, the fear, particularly with the concentration of a vulnerable population, of what might happen to their loved one, family member, whatever the case, or the separation that was required because of the quarantine restrictions, first of all, and then second of all, the limitations or the really abstinence of any personal visits. Most families chose to keep their loved one at home best they could, and we fully understand all that. And as you posed, that places a great deal of burden on that family. They already are contending with the circumstances of whatever else, if they're multi-generational things. We know about in-home schooling. We know about challenges of working remote or working remote sometime, going to school sometime, and to have the added expectation of caring for yet another senior person at home who is becoming likely increasingly dependent is a very tough hand to be dealt for anyone these days. What we're beginning to see is that with the in-person visitation, that people are generally understanding and expecting, particularly with the hope for virus or the vaccination that will be soon coming, we believe, that there won't be the types of restrictions reimposed on the senior living communities as long as they're very careful and don't have any particular outbreak of coronavirus. And there's some opportunity then to begin to alleviate some of that build-up pressure that families have felt, and we are seeing some families now understanding, accepting, believing that there won't be the same sort of, though necessarily, draconian restrictions that were put in place initially, that now that we have a better understanding as a world from a healthcare standpoint, that these things can be generally better managed than when there was so much uncertainty and lack of knowledge about them. And we've also are aware that in some cases we have multi-generational families, that young people will do what they do, and they still come out and visit. And one of the most challenging matters for all of us is, what do you do in the case of an asymptomatic type of person and is teenage son, daughter visiting and asymptomatic and then bringing something home? Is there an asymptomatic family member for some other type of interaction with others? There are all these worries, concerns, as well as the burden and the effort that's required to continue to care for somebody at home. And that has just been such an excruciating, difficult matter for, I suspect, and we know of many families in terms of caring for people at home during this last 6-7 months now.
So, John, I'm assuming then, listening to you talk about that, the best thing people could do at this point would be to, obviously things are much different now than they were in April when all this started, March and April. The best thing that families could do if they're in that point is to educate themselves on what is out there, how the facilities are handling, whether it's visits and protocol to keep the coronavirus out, and if it's in the facilities to keep it quarantined and everything else. So the best thing to do is to educate yourself, because you really might find out that it is better for your loved one to be in there with that type of 24-hour care, if that's the care that they need, as opposed to staying at home.
Yes. Yeah, absolutely, Tom. I would say that that's very important, is the education. And one of the determinations that I would suggest families make in that consideration is how transparent is a community about being forthcoming about the number of cases that they have, either at for residents or employees or whatever. And in our case, there's a weekly communication about whether we have asymptomatic employee who tested positive, and sometimes, as we know these days, some of the tests are false positives, depending upon the type of testing that's done. So there's all kinds of matters that a family ought to concern themselves with regard to that education process. And yes, what are the safety protocols that have been put in place? What are the expectations for those, as best can be predicted? And I keep maybe looking at the future a lot and hoping and expecting that with this vaccination, whenever that's to come, not everybody will be vaccinated, we know, but many of the residents and healthcare workers will likely be given priority, whether that's a bit controversial potentially, but it's also understood that the people that are most vulnerable are the aged and those with other health issues, and likely they're the ones most in need of being vaccinated, again, if they choose to be. and certainly the employees that work with in hospitals, senior living communities, or any of those who are most vulnerable need to be inoculated too, if they can be or choose to be, and hopefully that will lead to a better environment. So I think not only is it a case of today, here and now, it's also, can we look a little bit ahead to the future, and can we anticipate and expect, kind of form a vision in our mind about what those future dates and experiences and interactions will be, so that we can have a good sense in that educational process about what might we expect were we to have somebody in a senior living community.
Now, John, I know the other thing that you're doing there too is there's a lot of and other facilities as well, a lot of preemptive testing that you're doing is precautionary. In other words, sometimes, of course, if there's a contact tracing, and if someone has it, whether it's a staff member or a resident, there's testing there. But there's a lot of preemptive testing that is going on that is being conducted by your own personnel, and of course, that changes week to week with CDC and Ohio Department of Health protocol and everything else, but again, you're being proactive as far as some of the testing, and to try and keep somewhat of a handle on what you have there. Correct?
Absolutely. Just yesterday, I had my test. I've had several tests already, and that's the case for our employees. And for those that haven't had the test, it's not exactly one of the most pleasant things in life, but it's not one of the most ugly or difficult things either. But yes, we test every 2 weeks unless there's a employee or resident who has some experience, or if we're deemed code red in one of the counties, then we test more frequently, and we test also too if any of the residents or employees show symptoms that are known to be associated with the coronavirus. They too are tested, and we actively work with the Summit and Medina County health departments, get guidance from them were we to have a suspected or actual known case. And so we're doing a number of different things. We have a machine that we check in every morning that we answer a number of questions, and also that relate to symptoms associated with the coronavirus, and it automatically takes our temperature and so on and so forth. If it's above a certain threshold, we go home, and that's it. We just don't even go in the community. So. And we're still very guarded and careful. We're holding a lot of our meetings that would be administrative in nature. They're held off-site. So there are a lot of precautionary measures that have been taken here to restrict the not necessary visits, and also to try to screen people as they're coming in, employees particularly, but also we've limited the number of other types of healthcare support providers, and try to winnow that down to fewer numbers of people, so that there are fewer opportunities for the virus to be brought in, even by asymptomatic people.
8:33 here on Wadsworth Community Radio. We're speaking with John Stoner of the village of St. Edward. John, if a family is considering having one of their family members move into your facility, are they able to come in and take a look around and see what it's like? Is that procedure somewhat restricted because of the pandemic? How would folks be able to get a look at what you have for their family member?
Well, some of this is regulated, Joe. Good question. The primary interaction previously was by a virtual tour, and as we all know as humans, we kind of get an idea about that, but we really like to feel it. We like to see it, and particularly when there's a consequential change in one's venue in life and want to, this is a semi-permanent or permanent change where somebody's going to live. And we're someone to get to a point where they're fairly committed to coming to the village. We do offer limited tour opportunities so that people can actually see for themselves again. It's only practical, only appropriate, only reasonable. Now we have to do so under very restricted environment, that is particularly with assisted living. Independent living is a little more relaxed in terms of that, but we still have our own kind of guidelines, restrictions, so that, again, we're trying to be very careful and guarded about the number of people that come in. But as far as those that are coming to making a decision about where are they going to live, absolutely. They must and they should be able to see where that may be and what's it look like and get a little bit of a feel for it. Is this the place or is this not the place for them?
John, it also seems that your staff and your administrative people and all of that, this wasn't, to use a football phrase, I'm sure this wasn't in the playbook. We don't have pandemics. Well, the last one was 100 years ago. So how do you just learn to adjust on the fly? There's a lot of things you can't plan for, and maybe this was, a lot of this was one of those things. Is it just, it's like, you have to, be ready at a moment's notice to, kind of pivot and go the other direction if you have to?
Yes, and what's changed over time in that regard, Joe, is that initially we really had very little in terms of any type of playbook. It was all largely improvised or governed by some governmental organization, whether it be the CDC or the Departments of Health or whatever they were telling us we needed to do. But over time, as we become, as I think mentioned earlier, more familiar with the virus, its transmission, its containment, precautions that are needed to be taken to restrict its introduction, let alone once, if it were to be introduced, how do we find out how did it come, what are we doing about that? Those things are all matters that we learn kind of on the fly, as you said. And now, because there is such a familiarity with it, not that there wouldn't necessarily be anything new sometime, we have a pretty good idea about what to do. And in any and most every situation where, let's say, an employee were to show signs or symptoms of the coronavirus, or if they were asymptomatic and we, through our regular testing, what do we do? If a resident were to show signs, if a resident were not to show signs but were to be tested, what if the county is declared red or purple or one of the higher levels of presence of coronavirus? We generally have a pretty good idea about what to do now, and a lot of communities have talked with each other, and through our association at the state level, we're getting a lot of good guidance and a good sense of what we must do and need to do in most every situation.
John, before we wrap up here, the one thing, we've touched with the facilities, the families, the protocol. Talk a little bit about, I think we'd be remiss if I didn't give you a chance here to talk a little bit about all of your staff at the facilities, all the way down from, the health care, all the way down to maintenance and everything else, because there's a lot of double, triple, quadruple extra duty that a lot of your personnel has put in. People that did one job are now doing other jobs and back and forth. And I think that a lot of the benefits and everything that the residents are getting has a lot to do with a lot of your staffing.
Yeah, that's for sure, Tom. Appreciate that opportunity. I'm trying to look at my shirt here. I'm wearing a T-shirt that says "Not all superheroes wear capes, some wear masks. And indeed, that is the case. And we've seen in many communities where there are senior living, congregate living, about heroes. And indeed, they are. Many of the folks have been, are, and are heroes. They, at first, were uncertain about the risks that they were taking in terms of maybe contracting the coronavirus, or maybe even feeling responsible for its prevalence. Were they to be asymptomatic and bring it in? But there are so many other things that we encounter these days. It's hard on families. It's hard on the residents. It's hard on the employees to adjust to all the very restrictive environment that's been put in place. And a number of the employees have had to do, as you suggested, many things that they were unaccustomed to doing. And there's certain people that have a certain type of reaction. Some are still very fearful, and some are very cavalier about the presence of the pandemic. And it creates some interactions with families, residents, with our own employees, stressed, pressed, that wouldn't ordinarily occur in other times. But I think that's one of the things that we've been very good at. We've been trying to, when we see a pressure point rising, we try to help each other out and say, look, it's about time you take a little time off, or how about taking a break here, or let's bring in some pizza or something like that to try to recognize and to suggest there are still moments of normalcy that exist in our world today.
All right. Well, John, thanks for joining us this morning. We really do appreciate you taking time out from, again, as we mentioned, double, quadruple duty, and there at, and again, obviously being in charge of all three facilities. So thanks for joining us this morning and giving us some updates on the senior care facilities and living here in the area. Really appreciate it.
Absolutely. Tom and Joe, thanks for having me. Great talking with you, and hope we help the audience with some information that will help them in their discernment, their guidance, and determination about what they would do in the future.
Okay, John. And again, we're looking forward to when we can have you guys back in the studio to talk to us face to face. We'll have to. Well, maybe we'll actually recognize each other.
Amen. I'll be there.
All right.
With the mask, it'll be great. I'd rather do that too.
All right.
That's one of the things I miss too, guys. All right. Thanks.
Okay. You take care. Okay. Bye bye.
Right,
take
too.
care.
Bye.
Bye. This is 97.1 Wadsworth Community Radio.